The hydatid cyst of the liver is a parasitic infection caused by larvae of the tapeworm Echinococcus granulosus in the hepatic parenchyma. Humans are considered accidental intermediate hosts, while dogs or other carnivores are the definitive hosts of the parasite. The eggs of the tapeworm are excreted by dogs and ingested by intermediate hosts, including humans. Once ingested, the eggs release larvae that migrate to the liver, where they develop into cysts. The infection can remain latent for many years. At the beginning, the hepatic hydatid cyst is generally asymptomatic, which explains the often late diagnosis, frequently made during complications. The X-ray may show a cyst image with a specific density and abdominal ultrasound. This is the examination of choice to identify cysts and evaluate their size. The complications of a hepatic hydatid cyst can be severe and vary depending on the location and progression of the cyst. The increase in cyst size may lead to compression of the main bile ducts, resulting in progressive jaundice due to obstruction of bile flow. The compression of the portal vein may cause portal hypertension, which leads to blood accumulation in the portal system, potentially resulting in esophageal varices or ascites. The compression of the hepatic vein and inferior vena cava can cause Budd-Chiari syndrome, manifested by abdominal pain, hepatomegaly, and an increased risk of liver failure. The opening into the bile ducts may cause acute cholangitis, an infection of the bile ducts characterized by fever, abdominal pain, and jaundice. If the cyst ruptures into the peritoneum, it can cause generalized acute peritonitis, which is a severe surgical emergency. Meanwhile, a slower or progressive rupture may lead to secondary peritoneal echinococcus, a persistent infection of the peritoneal cavity by cystic germs. A cyst may also become superinfected, leading to a hepatic abscess. A fistula between the cyst and the respiratory tract may occur, resulting in hydatid vomica, meaning the expectoration of infected fluid originating from the cyst. Urticaria and itching may occur due to the release of parasitic antigens into the bloodstream. In the event of cyst rupture and massive release of its contents, anaphylactic shock may result, which is a severe, life-threatening allergic reaction. Finally, the hydatid cyst may also develop in other organs, particularly the lungs. The prevention of hydatidosis is based on a combination of sanitary, veterinary, and educational measures aimed at limiting the transmission of this parasite between definitive hosts and intermediate hosts. We should raise awareness among exposed populations about the mode of transmission of the disease and encourage good hygiene practices, particularly hand washing after contact with dogs or livestock. It is also important to develop vaccines for livestock, especially sheep, and regularly administer deworming treatments to domestic dogs to eliminate the parasite from their digestive system. Plus, avoid feeding dogs with viscera infected by hydatid cysts. Fourthly, reducing the population of stray dogs, which represent a major source of parasite spread, and veterinary control of livestock slaughter by implementing strict inspections in slaughterhouses to detect and eliminate infected viscera. And finally, organizing ultrasound screening campaigns in high-risk regions where hydatidosis is endemic.